Hey y'all, let's get to the feet and ankles, maybe the knees too. Okay, so let's say you're scanning a foot. I like to use the head holder. So pretend this is a head holder where you do head scans. You put the head holder here. If it's the right foot, have the patient scoot as much as you can to the left side and pretend this is the centering line of the laser beam. So if you have the centering line here and the head holder is supposed to be there, just have the patient put their foot there and scoot as much as they can to the left side. What do you do with the other foot? Because sometimes the other foot, there's really no space for that and you don't want it in the area. So have them bend their legs up, and the head holder has that metal piece right there. So just have them kind of lean that foot there because the knees could hit the gantry when it goes in. So remember, the laser beam's here. The head holders right there, have their foot there. If they can flex it, flex their foot. Because if they're not flexing, their foot's gonna go like that, and when you reconstruct it, it's not gonna be like straight. So if they can, have them flex it up, relax, and then let's say this is a head holder and they keep like kind of going to the side. What I like to do is I roll up some towels, and let's say like this one, I'll just roll it up and I kind of tuck it in that head holder, and it'll help them not like go to the side too much. So bend this leg, bend the opposite leg, use a head holder that goes up, and that way when you're actually scanning and using your scout, you don't see two foot, you don't see both the feet, you just see one foot. And that way, you don't get confused right or left. But you should know that the right side's on the left side of the screen and the left side's on the left side of the screen. And so this would go for the same with the ankle or the foot. And in CT, the foot, you normally get the ankle joint to the top of the toes. So you'll get your AP and then you'll get your lateral. So opposite side, if you're gonna do the left foot, have them scoot as much as you can to the right side, foot here and there. So that's the helpful, and then bend the right foot if possible. Some people don't use a head holder, and what you can do is just have them like put their foot down flat. Flat is fine. Just is that the ankle is gonna be kind of going this way up. So this is just another way you can do it. You can go like that straight, and then you can have this side scanned flat on the table. So that's another way. It just depends on your patient, right? If they can move, if they can't move, if you have a head holder or not. But just make sure you try to get in that center line. So the center line will be there. So the center line will shoot through here, and then you want the other line, their other axes, to come here. And of course, if you're scanning an ankle, make sure it's lower because you don't need the toes, you need the ankle. So you'll bring the patient up, move the patient up, that way the line's here and there's a line here. And then some machines you start from top, or some machine you start from the joint space. So just look at your anatomical reference point of where to go. So essentially that's how it is. This is not a video of how to reconstruct a foot. This is a video of how to position the foot and ankle. I'll probably make another video for the knee so it's not so long and confusing. But yeah, reconstruction of the foot can be kind of difficult, but you want to look at the heel, the calcaneus, of course joint space for the ankle, and then there's like the talar bone and all that. It kind of gets confusing without seeing it, and I don't know literally how I'm gonna, let's not look at my feet anymore. So yeah, I'll see how I can show the reconstruction, but as for right now, this is just positioning tips. Hope it helps, and thank you for watching. Toodles, noodles.